Okay, so today we're going to talk about how to write a general management of a patient and also a nursing care plan. So, under a general management, there are two things that are involved. There is the medical treatment and also the nursing management. So, before you start anything else, generally, as you write the management, you need to have the aims. What are your aims for this patient as you manage them? Then, under medical management, there are things that you need to do, and these things include physical examinations. You need to examine this patient physically. You also need to do history taking. You take history from the patient, which will act as your baseline data. Then from there, you can go a step further and do laboratory investigations, depending on the condition that has been presented before you. After you go about with your laboratory investigations, you can now go and do your pharmacological treatment of the patient. This will be determined by the data that you find from your physical examination, your history taken, and your laboratory investigations. After you are done, you can now do your nursing management. Now, under the nursing management, this is now where they are going to have a general nursing management or specific nursing management, depending on the condition that has been presented to you. And you can use the acronym of a profanum. And this, you can choose the necessities from that, then you can manage your patient. So under the general management, that's it. We can now go and deal with the nursing care plan. So the nursing care plan has got a few things that it has. And remember, we use a nursing care plan to give critical care or specific individualized care to a patient. And we know a nursing care plan comprises of the problem, the nursing diagnosis, the goal, the nursing interventions, and the evaluation. So, under your problems, when you have been given a problem, you have an actual problem and a potential problem. So the difference between these two is that the actual problem is what the patient presents with, and the potential problem is what can be the outcome of that condition that the patient has. So, and then under the nursing diagnosis is based on evidence and it is related to something. So, that is how you come up with your nursing diagnosis. Then the goal. The goal is always patient-centered. Your goal for the management should be patient-centered and it should be time-centered. Whatever you do, you must have time limit. Then the nursing interventions. Nursing interventions also have they also have to be patients focused always, and they are time centered. Then the evidence also is patient centered. It is time focused and based on evidence. After you evaluate, you actually see the evidence of the outcome, whether it's good or it's bad. Thank you.